Student, next topic is disorders of circulatory system. Many people are suffering from heart diseases. These include stroke, congestive heart failure, stroke, heart block, angina. So these diseases have become very common, heart-related problems, and even they are becoming very common in young people also. And heart diseases are the major cause of death among the youth and old people. So that is due to our sedentary lifestyle and lack of exercise and our poor diet. So today we will discuss few heart diseases which are the cause of death and are the major concern for us. Okay. So by studying heart diseases, we can change our lifestyle accordingly. First heart disease is hypertension. It is also called high blood pressure, high BP. You know, normal value of BP is 120 upon 80. 120 is systolic blood pressure when heart chambers contract, and 80 is diastolic pressure when heart chambers relax. You know, there are always two values which are noted by doctor in blood pressure, but when pressure exceed then 120 and 80 means pressure become high than systolic and become high than diastolic, means 140 upon 90, 150 upon 95. All these are conditions of high BP. So what is the reason of hypertension these days? First, I told you it is due to lack of exercise. And what are the major reasons? That is stress, depression, lack of exercise and poor diet. These are the factors, or due to consumption of more saturated fat, even obesity. So mainly stress and anxiety these days and even smoking are the major causes of hypertension. And these have various serious effects. Why? Because due to high BP, what may happen? The blood put pressure on arteries of eye may burst, it may lead to blindness. Even it can cause stroke. Due to high BP, nerves or neurons of brain may burst, which is called stroke. Even clots can be formed. Nephritis, arteries or related to kidney, they get damaged. Due to high BP, many arteries may get damaged and it may lead to serious implication. Even it may lead to heart failure or even death. So it is the need of the hour that we should change our lifestyle. This is becoming very common even in youngster and children also. In extreme cases, high BP may lead to paralysis also, in which body parts stop working. Next is arteriosclerosis. What is the meaning of this? It is hardening of arteries due to the thickening of fibrous tissue and calcium. In this case, arteries lose elasticity because in them fibrous tissue and calcium crystals get deposited, due to which arteries become very stiff and their elasticity is lost. So when blood moves from such stiff artery, it increases blood pressure, so it leads to hypertension. This is also one of the reasons of hypertension. And even in such arteries, clots may be formed and arteries get blocked. Next is atherosclerosis. Can you see? Atherosclerosis is narrowing of artery due to deposition of cholesterol. You know, this is artery lumen. Cholesterol get deposited. So when in the lumen cholesterol get deposited, the artery lumen opening become very narrow, due to which again blood flow with high jerk and pressure. So it lead to hypertension. Even clots may form. And sometimes when clots are formed in coronary artery, what is coronary artery? Which supply blood to heart. If it is blocked, then heart muscles get damaged. It may lead to heart attack and various other serious implications. Heart failure may occur, heart attack may occur. So one of the reasons of angina and heart attack is this. atherosclerosis. It is due to consumption of high saturated fat diet and which include no exercise. Okay, so fat keep on depositing inside the arteries. Next is coronary artery disease, in which coronary artery undergoes atherosclerosis. I told you earlier, in which coronary artery become very narrow due to deposition of cholesterol, and coronary artery supply blood and nutrient to heart. So if it is blocked, then heart is deprived of oxygen and nutrient, then its muscles start getting damaged and person feel pain, means symptom of heart damage start. Okay, and even it may lead to heart attack or even heart failure, because if heart is not getting every time proper oxygen or nutrient. Next is angina pectoris. Angina means acute chest pain when no sufficient oxygen reach to heart muscle. What happen? Angina means acute pain in the chest. And how we can notice angina? When pain travel from left shoulder, left arm and left wrist, then these are the symptom of heart damage. So when it happen, when arteries which supply blood and oxygen to heart, they are blocked or damaged, then heart muscle don't get when sufficient oxygen, because heart muscles are not getting oxygen but heart is working round the clock. So due to insufficient of oxygen, muscles start very forceful contraction, because they need oxygen, they contract rapidly to get more and more oxygen. So then due to that person feel pain, means it are the indicator that our heart is not getting sufficient oxygen. It is the symptom we should quickly recognize. It may lead to even heart attack. Muscles may get damaged. So what is heart attack? We are generally talking heart attack. Heart attack is that condition in which heart muscles start getting damaged. One heart attack, some part of heart muscle is damaged. Second heart attack, more. So damage become more and more prominent. And even after second or third heart attack, person may die. So all diseases are separate. In heart attack, muscles of heart get damaged. And angina, heart does not get sufficient oxygen. And one more is there, heart failure. What is heart failure? All these factors get combined when coronary artery or artery which supply blood and oxygen to heart, that get blocked, or due to high BP. What happen? Heart does not work properly, and inability of heart to supply sufficient blood or oxygen to vital organ. When heart is not able to supply sufficient oxygen or blood to different organs, then that condition is called heart failure. So it may lead to blockage, clots or stroke. Okay, and body part, they start getting damaged because they are not getting sufficient oxygen. So lot of load and pressure on heart increases, and heart is not able to supply blood to vital organs. So your organs start getting affected, because heart is the main organ which is supplying blood and oxygen to every part. So these we have studied various disorders, okay, in which we studied reasons are different, but some points are common. That is, we have to change our lifestyle. Lack of exercise and due to consumption of cholesterol, different parts of heart are affected. Okay, so these were various disorders.